Hi Janelle, my name is Giselle. I'm your occupational therapist for today. Today we're going to be doing a cranial nerve exam. Pretty much what we're going to be doing is just seeing how your brain communicates with your body through signals, through the nerves. So these nerves pretty much help be able to smell, see, be able to move your body, and just do the things that we do every day. So for occupational therapy, that's very important for us because if there is a dysfunction in one of those cranial nerves, then we can address it so you're able to do all the things that you like that are meaningful to you. Okay? So for this exam, I will need to be up close and personal to you. At some point, I will need to touch you. Do I have your consent to do so?
Yes.
Okay? So with that being said, if at any point you feel uncomfortable or you need me to stop, just go ahead and let me know. Okay? You ready to start?
Yeah.
Okay, so for this first cranial nerve that we're going to do is going to be cranial nerve 1, which is going to be your olfactory. So for this one, what I'm gonna have you do is I'm going to have you close your eyes when I say go, and you're going to cover one nostril, okay? I'm going to put a scent under your nostril and you're going to tell me if you smell it and what it is. Okay, you ready? All right, so I'll have you close your eyes. Can you cover one nostril for me? All right, and then I'll just have you smell. Okay, are you able to smell that? What smell is that?
Like a sweet smell.
Okay, now I'll have you keep your eyes closed and now cover your other nostril. All right, ready? Okay, were you able to smell that? Okay, what smell is that?
Like coffee.
Okay, so with that, your first cranial nerve for olfactory is intact since you were able to smell bilaterally, meaning on both sides. So for this next one, I'm going to be testing your optic nerve. Before I do so, I do need to ask you a few questions, okay? The first one is, do you wear any glasses?
Yeah.
Okay. When you wear glasses, are you wearing them throughout the day? Do you wear contacts or is it just for reading?
Just for reading.
Just for reading? Okay. So before we start, I do want to take a look at your pupils. So I want to make sure that they are the same size before I do start, okay? So I'm just going to take a quick look. I'm going to get up close. So both of your pupils are round and equal. Now, I do apologize. I do have to shine this really bright light into your eye, but all I'm going to do is just put my hand on your nose, okay? And I'm just going to quick look. So just look at my nose, ready? Okay, so pupil constricts and accommodates. So now I'm going to do the same thing on the other one, ready? Okay, pupil constricts and accommodates, okay? Now I'm gonna give you a few seconds to just get your eyes to relax again, given the fact that I just shined a really bright light at you. In a few seconds, I'm going to put my hands over your eyes like this, and I'm just going to check your eyes again, okay? All right, so just a few seconds. All right, if you need to blink, you can. Okay, are you ready? So now I'm going to come up close, just look at your eyes. Okay, so your pupils are getting bigger, so they're dilating. And now with the light, they're accommodating, so they're back to normal. Okay, so pupils are equal, round, reactive to light, and can accommodate. So now we can go to your optic nerve number 2. So with this, at the same time, I'm gonna have you close your eyes when I say go, and I'm going to be showing you numbers. And you're going to tell me what numbers you see, okay? So I'll have you close one eye first. Okay, you ready?
1, 2, 3, 1,
Okay, now I'll have you close the other eye. Ready?
2, 2, 4, 1.
Okay, good. So now you can go ahead and open your eyes. And both eyes are going to be intact, so the optic nerve is good since you were able to correctly identify the numbers. For this next one, it's still going to be your eyes. I'm going to be testing optic nerve 3, 4, and 6, which is your ocular motor, your trochlear, and your abducens, okay? So for this one, I'm going to have you stare at the tip of this pen, okay? And then just let me know, do you see 1 or 2 pens?
1.
Okay, so there's no signs of diplopia. All I'm gonna have you do is don't move your head, just your eyes, okay? You're just going to follow the pen. Okay. Okay, so you can go ahead and rest. There is no signs of nystagmus, meaning that your eyes are shaking, or no sign of strabismus. So that means that those 3 nerves are intact. Now for this next one, I'm going to be testing your cranial nerve 5, which is your trigeminal. So for this one, can I have you go ahead and pull your hair back? Okay, so I do have this cotton ball, and I'm going to be putting it on your face. So can I see your hand? So this is what it feels like, okay? So I'll have you close your eyes when I say go, and I'm going to put this on either your forehead, your chin, or your jaw, and you're going to tell me where you feel it, okay? So I'll have you close your eyes, and this is for light touch. Ready?
Forehead, jaw, cheek, jaw, forehead, cheek.
Okay, so you can open your eyes. So light touch is intact. Now I'm going to use this cotton swab that is broken in half. So I'll have your hand for a second. So this is what sharp feels like. This is what dull feels like. So same exact thing. I'm going to do it on your face. You're going to tell me if it's sharp or if it's dull. Okay, ready? I'll have you close your eyes and we'll begin.
Sharp, dull, sharp, dull, sharp, dull.
Okay, I'll have you open your eyes. So with that, that means pain sensation is intact. For the next portion of this nerve, we're not going to do the corneal reflex, but I'm going to have you squeeze your jaw together as hard as you can. I'm just going to feel for your masseter muscle, okay? So go ahead and squeeze. Okay, so masseter seems to be even and strong. So for this next one, I'm going to put my hand under your chin. I'm going to have you open your jaw, but don't let me close, okay? Ready? Open jaw and don't let me close. Okay, MMT is at a 5. For this next one, I'm going to be testing your jaw jerk reflex, okay? So pretty much I'm going to be using this reflex hammer, and I'm going to put my finger onto your chin. I'm going to then use this to hit my finger, and I'm just going to see if there's any reflex, okay? So I'll have you open your jaw, okay? And I'm going to just hit my finger. Okay, so there is no jaw jerk reflex, meaning that your trigeminal nerve in general is intact. Okay, so now for this next one, I'm going to be testing cranial nerve 7, which is your facial. So all I'm gonna have you do is I'm gonna have you do a series of facial expressions, okay? So I'm going to have you raise your eyebrows and look up. Okay, seems even. Okay, come and look back down. I'll have you now close your eyes as tight as you can. Okay, good, seems even. Now I'm going to have you make a really big smile. Okay, can you do a little bit bigger? Okay, seems even. Now a frown. Okay, so seems even as well. And I'm gonna have you now blow your cheeks up like this. Okay, so seems even on both sides for all facial expressions, so that means that that facial nerve is intact. Now we're going to move on to cranial nerve 8, which is your vestibular cochlear nerve. This one is just really fancy of saying how you hear and also your balance, okay? So for this first one, I'm going to be doing a test with this tuning fork. So all I'm going to do is I'm going to just hit my hand, it's going to vibrate, and I'm going to put it on the center of your head, and you're just going to tell me if you hear it, okay? Okay, do you hear that?
Mm-hmm.
Okay. Is it even or is it on one side more than the other?
It's even.
Okay, sounds good. Now for this next one, we're going to be testing your balance, okay? So I'm going to be putting this gait belt on you just for safety, okay? So I'm just gonna put this around. Can you raise your hands up just a little bit? So what I'm going to be doing is, just really quickly, is this tight?
Mm-hmm.
No? Okay. All right, so we're going to be doing the Romberg test. So like I said, this is just for safety. So just in case if you lose your balance or anything like that, I can grab onto you, okay? So I'll have you stand up, and you're gonna put both feet together, and then you're going to cross your arms. Okay, when I say go, you're going to close your eyes, okay? Like I said, if you feel like you're losing your balance or anything like that, I'll be around just to make sure I can catch you, okay? Ready? And go ahead and close your eyes. Okay, good. Okay, just a few more seconds. So far, there is no signs of you losing your balance. Okay, you can open your eyes and then you can now take a seat. So with that, we can say that the vestibular cochlear nerve is intact. So for this next one, we're going to be testing your cranial nerve 9 and 10, which is your glossopharyngeal and your vagus nerve, okay? So for this one, I will be coming back with this light. I'm going to have you open your jaw as wide as you can, and you're going to stick out your tongue. When I say go, you're going to say ah, okay? Ready? And open your mouth, stick out your tongue, and then say ah.
Ah.
Okay, good. You can go ahead now and close your mouth. So uvula is in midline, and the soft palate also raised, meaning that your glossopharyngeal nerve is intact. So given the fact that we were talking, how are you feeling so far?
I'm pretty good.
Pretty good? Okay. So we're almost done. Given the fact that we were talking a little bit, I have not noticed any signs of low quality when it comes to your voice. Pitch seems fine. You've been able to respond very well. So that means that your vagus nerve also is intact. Okay? So we have 2 more to go. We're going to now test cranial nerve 11, which is your spinal accessory nerve. So for this one, I'm just going to have your arms out slightly. Good. And I'm going to have you bring your shoulders up to your ears as high as you can, and don't let me push you down. Ready? Okay. Looks good. So go ahead and rest. Now I'm going to be also testing once again. So this was for your trap. I'm going to do another one for your trap. And then we're going to do sternocleidomastoid. So we're going to have your left ear to your left shoulder. Okay? And once again, don't let me push you to the center. Ready? And go. Okay, now to the other side. Okay, and don't let me push you. Good. All right, now you're going to turn as if someone just called you. Okay? So looking for sternocleidomastoid, and don't let me push you back to the center. Very good. Now go ahead and like to the other side, same thing, and don't let me push you back to center. Good. All right, so you can rest. All MMTs were out of 5, so that means you're very strong, and those nerves are working towards those muscles, which is very good. All right, last one is going to be cranial nerve 12, which is your hypoglossal nerve. So once again, I'm gonna have you stick out your tongue for me as out as you can, and I'm just looking to make sure that it is even, which it is. It's staying right to the center. Now I'm going to have you stick out your tongue again, but this time you're going to move it to the side like this. Okay, go ahead and go side to side a little bit faster. Good. Okay, so there is no signs of weakness. Once again, it stayed at midline, so that is also good. And for this last one, I'm just going to have you repeat a phrase to me. Okay, ready? So we're going to do the quick brown fox jumped over the lazy dog. Can you go ahead and repeat?
The quick brown fox jumped over the lazy dog.
Okay, so now we see that cranial nerve 12 is intact, and that is all for today. Thank you.
Okay, so after the cranial nerve exam, my client was able to have all cranial nerves intact. So hypothetically speaking, if she were to have cranial nerve 11, the spinal accessory impacted, it's going to be very important for her specifically since she is an athlete, a student, a sister, and also a girlfriend, which are all of her roles and responsibilities. This nerve essentially is going to be innervating the sternocleidomastoid and the trapezius, which are going to be very important for athletic performance. Also, in that situation, it's going to impact her ability to turn her head, stabilize the shoulder, and control the shoulder blade during different arm movements. So if this nerve is weak or irritated, she could have potential shoulder drooping, scapular winging, and just the inability to shrug her neck, shrug her shoulders, and essentially also have neck weakness. So this is going to be harder for her specifically to hold that strong posture, for example, in sports, as she has to do overhead movements, throwing, lifting, pushing, doing planks, and even having contact with the ball. So because of this, it is due to that shoulder not being stable. It's also going to impact different areas of her day-to-day life. For example, like carrying a backpack, washing her hair, putting on a sports bra, or just dressing in general, reaching into a high cabinet as she's helping her parents cook, and it can just lead to overall compensatory strategies. Psychologically, this is also going to limit her, not just only as an athlete, but it's going to impact all areas of her life. If her shoulder feels unstable or she's just getting in general, she has pain, she may be a little bit more hesitant to go to practice because she might be more afraid to re-injure herself, which in return leads into frustration, anxiety, and potentially depression. Given the fact that she is also in her teenage years, those feelings can also lead to isolation as well. Over time, if that pain and fatigue can continue, it will cause impacts in her motivation and her focus, which is at the same time going to impact her ability to perform in school, which in return can also make her feel as if she's falling behind or leaving or letting her team down as well. Socially, with the impact of this cranial nerve, there might be some challenges with certain roles and participation, especially since going back to her being an athlete, her team does have a strong sense of community, routines, and friendships. So if she does have that pain or that weakness or that limited mobility, it's going to impact how long she's able to train. It's going to impact her from not being to participate in certain team activities or workouts, or just go and do regular social outings that might involve carrying, for example, a purse or a bag or her gym bag. Given the fact that also it's going to impact her posture and endurance, it's going to impact how she's in school, from being able to sit in class, do her homework, work on a laptop, because she might fatigue a lot quicker. So as seen with these examples, if she does have a cranial nerve 11 impact, it is going to impact her overall occupational performance, and not just in one area of her life, but in all areas of the BPS model. So as OTs, it is important that we are able to address all areas of the BPS model when it comes to any sort of cranial nerve injury, to make sure that we're able to get our patients back to doing the meaningful occupations that they enjoy, and also being able to give them a sense of well-being, of belonging, which all in return plays a role in their overall recovery.